All right. Hello, everyone. Welcome to this webinar on positive youth development programs, preventing youth substance use. My name is Dr. Chudley Wirch, and I'm president and founder of Prevention Plus Wellness, LLC, located here in beautiful Jacksonville, Florida. Some of you who have taken in my previous webinars, have talked to me, probably can tell that I still have my cold because I still sound really nasal. And so I just wanted to apologize for having to cancel this webinar earlier in the week, and apologize yet again because I'm recording it and going to send everyone a link and post it on our website, because I found out that I'll actually be out of the country next week and am unable to provide this session live. So you're viewing this a recorded version, but if you do have any questions or need anything from me after viewing it, you're welcome to reach out to me anytime on our website, preventionpluswellness.com, or you can email me at info@preventionpluswellness.com, or you can call me in Jacksonville at our home office, 904-472-5022. So today's session will be about 30 minutes in length. Maybe even a little less. There aren't that many slides compared to what we usually present, but I think nonetheless very important topic and slides, and I'm excited about it. And we had a full registration, so appears there's quite a bit of interest throughout the country and world for this session. So if I can figure out how to advance the slide. Oh, actually, I'm sorry. Let me go ahead and enlarge the slides first, so that that might help everyone see them a little bit better. My computer is slow today for some reason. So 4 objectives for today. The first is to describe basic positive youth development facts, as well as principles and evidence for the effectiveness of positive youth development. Secondly, you'll be able to list 3 organizations using positive youth development to improve youth health. Thirdly, you'll identify 3 of, I think, 5 that we'll be presenting evidence-based positive youth development programs that have been shown to be effective for preventing youth substance use. And then lastly, number 4, you'll be able to explain the advantages, goals, and approaches for using Prevention Plus Wellness programs as positive youth development strategies. So let's dive right in. And first of all, talk about some facts in regard to PYD, positive youth development. So the history is that positive youth development actually developed out of the prevention field, the prevention science. And while prevention typically focuses on single problems, or a more narrow or focused array of problems such as substance use, or if you will, maybe even more specifically alcohol use, or even more specifically alcohol pops, which are the flavored, sugary flavored drinks that young people like. This gives you an example of how prevention typically addresses problems, and that is in a very focused way. So from that prevention focus, there evolved this interest in and need to promote asset building, along with resiliency and protective factors, rather than just always focusing on just negative content and needs that young people in particular had. And this includes, by the way, this asset building includes a strong sense of self-esteem, and future aspirations. In addition, engagement in school and community activities is a major component of positive youth development, and positive outcomes from early positive youth development programs led to strategies that not only reduced risks like prevention did and prevention continues to do, but also strengthen protective factors. So rather than just looking at risk factors, positive youth development attempts to address both the risk factors as well as the protective factors. And these facts come from the youth.gov site. If you want to learn more, youth.gov is a great site, lots of good content. And if you have registered for this webinar, I'll send you a link to the, obviously you're viewing it in this recorded session, but you'll also receive a link to the PDF slides. So you'll be able to click on that item number 7, youth.gov, if you want to go directly to that page, or you could just search youth.gov. Let's look at the positive youth development key principles. One is that positive youth development is an intentional process to promote protective factors. I'm assuming that what most positive youth development writers mean by this is that they mean it doesn't happen necessarily all by its own, but it is a planned process. So just like prevention is a planned process, positive youth development requires some planning and implementation. In addition, positive youth development complements efforts to prevent risky behaviors, as I mentioned with our previous slide. In fact, oftentimes positive youth development strategies will integrate the prevention of risk while promoting youth assets. The development and strengthening of assets and promoting growth is the key focus of most positive youth development. I would say all positive youth development programs. And the preparation of youth for a healthy, happy, and safe adulthood is the long-term goal. So it's a very broad, holistic goal and approach and strategy. Positive youth development engages youth as change agents. So it's not as you might expect some prevention programs where youth end up being rather passive recipients of the program. Most positive youth development strategies and programs engage youth more as change agents for their families, their classrooms, their communities, and so forth. And it instills leadership qualities through these activities and involves civic engagement, which is the development of social awareness and social skills. And this information, like the previous slide, comes from youth.gov. Again, very good website. Evidence for positive youth development, for the effectiveness. So at least one organization, the Association for Maternal and Child Health Programs, has listed positive youth development as an evidence-based public health strategy. Evidence has shown that positive youth development programs can reduce morbidity or illness and injury, as well as increase feelings of connectedness, again, to immediate environment, families and schools and communities, while decreasing negative social and health choices. This includes substance use, and that's what the focus of today's webinar is, positive youth development in relation to and focus on preventing substance use among youth. And there's evidence also that PYD programs increase positive relationships, social norms, and skill building opportunities. And this source of this information, again, is the Association for Maternal and Child Health Programs, and under number 6 there is the link, and I'm sure you could search as well and find that. Now, this is important because I thought it really sort of encapsulated and represented positive youth development in general, and that is positive youth development as related to juvenile justice. And this comes off from the website for Coalition for Juvenile Justice. And that is, number one, the positive youth development focuses on assets along with skills rather than risks and problems alone. So a lot more focus on assets and skills. Secondly, PYD programs are more effective than approaching only weaknesses or needs of young people. So a much broader approach is deemed to be more effective, and I would argue also more appealing to youth and families and communities and funding agencies than one just narrowly focused on a problem or an issue. And thirdly, positive youth development looks at ways that can be applied to prevent youth offenses. This is because this source of information comes from juvenile justice. So what are the positive youth development ways that can be applied specifically in terms of preventing youth criminal offenses? And you can see some of the bullets there. Encourage healthy lifestyle choices. These include physical activity and nutrition. Also support positive organized activities, including sports, arts, and faith-based groups. And thirdly, have young people set goals and get them to look and envision and a future of where their goals can be achieved, or giving them an opportunity to look at an aspirational or future or desired self. And again, this information comes from the Coalition for Juvenile Justice. Very good content there. I wanted to share with you three examples of organizations that focus on positive youth development and emphasize health. And these three organizations are Boys and Girls Clubs, 4-H, and the YMCA. So let's take a look at how each of them have integrated positive youth development for the advancement of overall health for young people who are served by those organizations. So starting first with Boys and Girls Clubs, they have health-related programs. And in fact, they have something called Health and Wellness, where the focus of their health and wellness programming is to develop capacity for young people to engage in positive behaviors, to set personal goals, and to grow into self-sufficient adults. And that certainly resonates with what I had talked about earlier with the overall principles and purposes of positive youth development. Secondly, Boys and Girls Clubs focuses on sports and recreation, and within that sphere attempts to develop physical fitness, reduce stress, and to promote positive use of leisure time and appreciation for the environment, and to develop interpersonal skills. So those are two areas that Boys and Girls Club focuses on: health and wellness, sports and recreation. And the third area is character and leadership, and the focus and these programs is to develop leadership skills to gain opportunities for planning, decision-making, and contributing to the club and the broader community. And you could learn more at boysandgirlsclub.org. So Boys and Girls Club, good example of how one organization focuses on positive youth development for the development of overall health and well-being of young people. Another example is the 4-H. 4-H has a healthy living program. So let me focus on that. Healthy living program for 4-H emphasizes learning how to lead lives that balance physical, mental, and emotional health. And they have three areas, I think, that are of interest here. Number one, they have substance use prevention and mental health. Secondly, they have a fitness and nutrition and safety focus. And third focus is on growing leadership skills and serving as champions and teachers of health in their, again, families and classrooms and communities. So you see a parallel here between these areas of emphasis for 4-H with perhaps some of the emphasis of Boys and Girls Clubs. The last example I'm going to talk about is of an organization that emphasizes positive youth development for development of health of youth is the YMCA. And they have three areas of emphasis that I think are worth noting in relation to health and youth development. The first is just called youth development, where their programs in this arena focus to and aim to nurture the potential of every child and teen by supporting their unique youth development journey through holistic program, or providing a range of different types of programming. So they have a youth development emphasis, as well as number two, a healthy living focus, where the emphasis there is to improve the nation's health and well-being by providing programs as well as activities that promote wellness, reduce risk for disease, and help reclaim health, which is, I think, unique, reclaiming health for those that youth that have health-related issues or problems. And then the third area, in addition to youth development, healthy living, is social responsibility, where the focus is on uniting individuals from all walks of life to participate and work for positive social change. So those are the three examples of, I think, are excellent examples of organizations that emphasize positive youth development for promoting the overall health of young people. And they're to be, I think they're to be certainly supported, and for those, for that kind of emphasis they provide in communities throughout the country. Now let's take a look at evidence-based positive youth development programs that have been shown to have substance use prevention outcomes. So what I did here is I went to, and yeah, I apologize for my voice going on a little bit here, but I'm gonna push through this, make this happen. And it's just a cold. It is not the coronavirus. It's just a cold, a regular, normal cold virus. I know this, just to get off the track a little bit. I know this because my wife had this cold for a week before me. She's a teacher, and so that's one of the perks of being married to a teacher. She brings home these viruses, and of course, kids are awesome vectors of disease, and so there's a long history of disease transmission, particularly colds and flu, in my house over the past decades of having my teacher be a special ed teacher. Anyway, sorry about that digression, but so focus now is on evidence-based positive youth development substance use prevention program. So what I did was I went to the Results First Clearinghouse database. Results First Clearinghouse is really a metadatabase, because it really is a database of 8 separate evidence-based programs registries. So it's really a meta database. So it's really a good one. If you haven't checked it out, go to it. And if you want to look for evidence-based programs, it's very comprehensive, because it's not 1 or 2 data registries, it's actually 8. And so you can learn more by going to Results First Clearinghouse database. And so when I was on the database, what I did was I searched under the heading, and I typed in the search terms positive youth development, and up came 95 total programs, positive youth development programs. Then I did just a separate search for substance use programs, and came up with 1,073 programs that were listed as substance use. And then I crossed those two, positive youth development with substance use, and came up with 51 programs that addressed both. In other words, 51 programs addressed positive youth development and substance use. And of these, a surprisingly low number, only 5 were rated highest or second highest, and actually reported substance use outcomes and had available information about them. So I was sort of disappointed that there were so few programs listed. That doesn't mean that there aren't others. And you know, these databases, you know, their search engine capabilities are not always perfect. So there may be more there than actually what was found. But nonetheless, I will share with you what I did find. And so the highest rated positive youth development programs that address substance use prevention were these 5 here. Number 1, and they're not in any particular order. Number 1, Protecting Strong African American Families, or ProSAAF. Number 2, Strong African American Families, or SAAF, which are clearly related programs. Item number 3, or program number 3, which isn't really a program but a system, which I'll describe in a minute, PROSPER. Number 4, Positive Youth Development Program. I mean, that makes sense. The title says so. Out of Connecticut, I'm assuming. And then fifth, a program that came up was one of our programs, the Sport Prevention Plus Wellness Program. So let me describe each of the programs for you. I'm going a little bit slow. I'm going to pick up the pace now. So protecting a strong African-American families. I just give you some highlights of them. This particular program targets parent relationships and skills. It consists of 6 two-hour sessions that usually are provided at home. It's developed for youth in the rural South, and it was found to have positive effects on substance use initiation and other outcomes. So, pardon me, but if you wanted to find out more, you could click on that link. And that would take you to a more in-depth a description of that program. Excuse me. The second is the Strong African American Families Program. That's a family-centered program for, obviously, as the title suggests, African Americans. Pardon me. It consists of 7 two-hour sessions. I'm going to need to take a cough drop. It's offered at schools and community facilities. So rather than the other African-American program, which was provided at home, this is provided at schools and communities. And an effective outcomes were found on alcohol use as well as other outcomes. And that's the Strong African-American Families Program. The third, Prosper, is very unique because Prosper is in the program per se, but it's actually by the way, Prosper stands for Promoting School, Community, University Partnerships to Enhance Resilience, and it is a program delivery system. So what this is about is you have a university community teams that implement an evidence-based program or programs to prevent youth substance use. This also includes a community team, a statewide, state-level university team, and a prevention coordinator team. And so this has been used at least on one occasion with positive effects found on illicit drug use, initiation, and broader substance use. So it's really not a program, it's a system. And what you get is you actually have a list of evidence-based programs that you could choose from, but the whole state has to be involved in this particular strategy. The fourth evidence-based positive youth development program with substance use prevention outcomes includes the positive youth development program out of Connecticut. This is a school-based prevention program, targets middle school students. It consists of a rather lengthy 20-session curriculum, and it's usually provided, or it is provided in 2 50-minute classes over a 15-week period, and outcomes were found in substance use as well as other positive changes. And then the last one, which I'm most familiar with because I'm the developer of the Sport Prevention Plus Wellness Program, quite a bit different than the program we just looked at, because rather than being 20 sessions, it's just a single session motivational screening and brief intervention for youth. And it integrates physical activity, nutrition, sleep, along with, in addition to substance use prevention. And it can be implemented in school, community, home setting, just about any settings where there's youth. And the outcomes included substance use as well as a number of other things, including improving physical activity. And so you can learn more about the sport program on that link. So what are some other Prevention Plus Wellness positive youth development programs? Well, we do have, for those of you that are not aware of it and haven't been to our website, preventionpluswellness.com, we have the InShape Prevention Plus Wellness Program, single session, evidence-based program for young adults. So it's a parallel program to sport. Then we have single session evidence-informed programs, which means that they're based on the screening and brief intervention as an evidence-based practice, And they're also based on the sport evidence-based program, but we haven't conducted research on them yet. And that includes the marijuana prevention plus wellness program, vaping prevention plus wellness, opioids prevention plus wellness. We have different versions of each of those programs, along with Sport 2 PPW, which is 6 sessions, the only multi-session program, and In God's Image, which is our faith-based program. Now, the advantages of prevention plus wellness programs compared to other positive youth development programs are these 4 items. First, as I mentioned earlier, prevention plus wellness programs are a single session. Most are about 45 minutes in length. So you could literally reach all youth or young adults. You could have really broad reach, meaning that you could have a true public health effect versus a multi-session, 15, 12, 6, 20, whatever the session may be. With one session, you're much more likely to have a much broader reach and therefore have a public health effect. Secondly, prevention plus wellness programs integrate positive fitness and health promoting behaviors along with goal setting and positive identity development with substance use prevention, which is why it is really a positive youth development program, why sport prevention plus wellness is really positive youth development. Thirdly, prevention plus wellness, particularly the sport program, but all of our programs include a script, so they're very easy to follow, and that reduces time for training. And in fact, our online program implementer training is just 2 hours live. And then lastly, you have this variability of implementing all of the prevention plus wellness programs as either individual tailored programs, one-on-one with the young person, or in a group, allowing greater flexibility. Now, there's 3 goals to using prevention plus wellness programs as positive youth development. So the first goal is the typical goal you might think of, and maybe the broader goal, which is to prevent substance use and to promote fitness and health, self-regulation skills to set and achieve goals, improve positive identities of youth. And this is done by implementing the one-session prevention programs to youth. This is a direct effect. So you implement your PPW program to youth, that alone can provide that positive youth development effect. But there's a second goal, and this is where you promote leadership and service skills and hands-on experience by training youth to tailor and plan and provide prevention plus wellness programs to their same age or younger age peers. So this is where the leadership skills come in. And because prevention plus wellness programs are a single session, the training is rather brief, it becomes a very, very realistic, practical, feasible strategy for youth leadership experience, service experience. And again, this is a direct effect. And the third goal of using prevention plus wellness as positive youth development is an indirect effect. This is where, by promoting success in athletics and academics and career, by enhancing wellness behaviors and identities and goal setting skills, by either providing prevention plus wellness directly to youth or training youth to provide it to others, this is the indirect effect. So it's a broader indirect effect. In other words, as youth become more physically active, eat healthy, get more sleep, and so forth, as they avoid substance use, they're also more likely to see success in academics and athletics and career and so forth. So that broader indirect positive youth effect. Now, how does prevention plus wellness link substance use and wellness behaviors and identities for positive development? Now, this I'm sure many of you have seen before if you've attended any of our other trainings or webinars, but I want to highlight it very briefly with you. And I'm just going to give you the heads up. We are going to run late with this. So it's going to be longer than 30 minutes, probably, I would say 40, 45 minutes. So the conceptual framework for all prevention plus wellness programs is the behavior image model, the BIM, the behavior image model, marketing related theoretical roadmap, for developing programs that integrate promotion of wellness with the prevention of substance use. And there's two components to this BIM model. The first is that the assumption that you can, and we have seen this and have evidence of this, that you could provide positive images in image-related terms, and by using those and sharing those with young people, that will increase their motivation for changing their behaviors. And then after the motivation has increased for change, then you capitalize on that by having them complete multiple behavior goal setting, which increases that self-regulation skill or self-regulation or self-control skills. Now, the effectiveness of using positive images is supported by theory, by research, and by practice. By theory, image is supported by a whole range of health behavior models, including possible selves theory. The role of positive images has been supported by research, which shows that positive images, positive self-concept, prototype images, possible or future selves, positive identity, all linked to, significantly linked to, associated with, and predictive of health risks. And then lastly, decades of use of advertising and marketing firms and large companies have shown that an emphasis on positive images, appealing images like the one to the right, is preferred to any negative imagery and is preferred to most other strategies for advertising. Very effective strategy for advertising, also effective for influencing decision-making for health behaviors. And this is usually occurs in a two-step process of developing messages using images, positive images for the most part, that link a wellness behavior to a substance use behavior. Step number one in this process is to present positive, desired future and peer images and other benefits of health-enhancing behaviors, whether that's physical activity, nutrition, sleep. And then secondly is to present how a substance use behavior or behavior is a barrier or interferes with achieving that wellness habit, as well as the positive outcomes. So what you're doing here in this two-step messaging process is to trigger or cue a mental image that young people already have. You're just cueing it in their minds. Happens almost instantaneously and non-consciously, but you trigger this image, this positive, desired, healthy image of themselves in the future, of their peers, of the healthy behavior being positive, substance use as being harmful. And you use image terms, vivid image terms, to do this in illustrations where they get to see themselves. So one example of this two-step process is, here's step one, positive images and other benefits of a health-enhancing behavior. Quote, young people who engage in regular physical activity tend to feel more energetic, sleep better, and look more active, fit, and confident. Now, the underlying terms are those very evocative evocative terms, energetic, active, fit, confident, and then also other positive outcomes are mentioned in improving sleep. So that's the first step, positive images and other benefits of that wellness behavior. And the wellness behavior here is regular physical activity. Here's the second step, you link substance use to being a barrier. Quote, marijuana use can reduce your energy level needed to participate in regular exercise and to achieve your fitness goals of being in shape, looking good, and feeling fit and active. So that's the linkage there. How, in this case, marijuana use can reduce and harm you being able to exercise regularly and all the positive benefits. Now, this is all put together typically in a single screening and brief intervention. In all of our programs are screening and brief interventions. And screening and brief interventions are an evidence-based practice according to the Substance Abuse Mental Health Services Administration. So you got the broader evidence-based practice, and then you've got evidence-based programs such as sport and in-shape prevention post-wellness. So the three steps to this screening and brief intervention is screen participants for current health habits using a screening survey. This gets them to think about, well, how what am I engaging in and not engaging in for health habits. Secondly, you provide feedback to them either individually in a group, excuse me, providing positive image messages. You use the script that's provided. You show some slides with those positive image terms, and they could see illustrations or representations of themselves, whether they're male or female, different types of activities, all very positive that they can relate to. And then that increases motivation for change. And then again, capitalizing on that by having them assisting your participating youth to set and monitor goals, not just to avoid substance use, but also increase one or more protective wellness behaviors. And so the other part to this, in addition to cueing positive images, is that self-regulation piece. And so self-regulation skills to set and monitor behavior goals, to avoid alcohol and drug use, but also improve one or more healthy protective wellness habits, and to make this a public contract with them. You sign it, you co-sign it, that increases motivation for change. Now I'm going to say just one more thing to link in the positive youth development here. If you read some of the literature in positive youth development, you don't have to read much before you'll see the 5 C's of positive youth development pop up. So the 5 C's of positive youth development are really developmental outcomes from positive youth development programs. They include competence, confidence, connection, character, and caring or compassion. So you could see a description of each of those. So for competence, the goal of positive youth development is to increase a positive view of one's actions in specific areas, including social, academic, cognitive, vocational, I would say physical as well. Confidence in the internal sense of an overall positive self-worth, self-efficacy, self-esteem, positive identity, and a belief and looking to the future. Third, connection, a positive bonds with people and institutions. That can include other peers and family, and includes all of these things, school and community, in which both parties contribute to the relationship. So there's some give and take. Fourth, character. That includes respect for social and cultural rules, a possession of standards for correct behaviors, a sense of what's right and wrong, in other words, morality, spirituality, and integrity. And then lastly, caring or compassion, which focuses on a sense of sympathy and empathy for others. So this is a very important slide because I'm showing you here how prevention plus wellness can help cost-effectively address the 5 C's of positive youth development. So knowing what you know from today's presentation about prevention plus wellness, even that brief introduction, you can see that under the first C of the 5 C's of positive youth development, the C of competence, prevention plus wellness programs help in competence to help young people learn self-regulation skills to set, monitor, and achieve a wide variety of health behavior goals that protect and promote well-being and success in athletics, academics, and life. Under the heading of confidence, positive youth development prevention plus wellness programs can help develop self-efficacy to set and achieve goals, but also a positive wellness identity, and to learn to look forward to a desired and improved future self. Thirdly, connection, positive bonds gained from interacting in a self-development experience, that is, again, prevention plus wellness interaction, either with an instructor or with a peer, with another adult or with a youth, and as well as with a parent or guardian. So, and when I say a parent or guardian, I'm specifically referring to the fact that sport prevention plus wellness includes parent flyers, and all of our programs include web-based resources for parents. So you can integrate that connection with the youth and parents in that broader discussion of positive behaviors and image, not just avoiding risky habits. Number 4, the fourth C of positive youth development, character, and prevention plus wellness programs help develop leadership skills when they implement a prevention plus wellness program, and even spiritual wellness behaviors and spiritual wellness behaviors are addressed specifically in the in God's Image program. And lastly, carrying a compassion, a sense of sympathy and empathy for others is increased when providing prevention plus wellness programs as a leadership experience. So let me just conclude these 4 points here. Number one, positive youth development aims to increase youth assets and protective factors leading to healthy lives and improved self-worth, self-esteem, self-image. Secondly, 3 examples of organizations using positive youth development specifically for the improvement of health include Boys and Girls Clubs, YMCAs, and 4-H. Very great examples. Number 3, there are at least a few evidence-based programs. We identified 5 of them that have demonstrated success in preventing youth substance use, and one of them includes sport prevention plus wellness, and prevention plus wellness programs have the advantage. I have a number of advantages over other positive youth development programs. Now, positive youth development can be very broad, and it can be very, very environmental and systematic, and really can include a lot of things and should include a lot of things outside of an instructional program. But prevention plus wellness programs can allow you to provide positive youth development in a very practical and immediate and cost-effective way. And this includes the integration of wellness promoting behaviors, positive identity formation, goal setting, and cost-effectively achieving those 5 C's of positive youth development. Now, here are some additional positive youth development research papers if you want to learn more about positive youth development. And if you want some resources in the area, here are a number of resources. And again, I'll be placing the link to this recorded webinar as well as these slides on our website. And you can go to our website anytime, preventionpluswellness.com, enter your email, and you'll be able to receive regular emails from us and stay in touch with all of our future free webinars and other activities and resources that we provide, as well as our evidence-based and evidence-informed programs. So thank you for joining. Thank you for putting up with my hacking and my coughing. I apologize for it. I am getting better, but I did want to get this recorded and sent to everybody. So thank you so much for attending this session. And if you do have any questions, just reach out to me, info@preventionpluswellness.com. I'm happy to answer any questions you have or any needs that you might have in the arena of positive youth development, particularly as it relates to our programs. Thank you very much, everyone. Have a great rest of your day. Bye-bye.